We are not gods anymore. I'm sorry. We've been brought down from that pedestal.
What is the biggest shock after BDS that nobody prepares dentists for?
A human being needs to treat a human being. If a machine is treating a human being, you cannot machine learn compassion. It's an emotion. It's not a data point.
Yeah. AI may be kind of a job cutter at rest of the places, but in dentistry, this is a big enabler in their treatment. But do you think many are compromising on the system, processes, or hygiene while growing, rather they are overlooked?
I think it is largely overlooked. It's a matter of integrity for the dentist and his team to do the right thing even when no one is watching. Before you buy your BMW, buy the CBCT or the intraoral scanner or the laser.
So what does successful dentistry mean to you today?
We lack an audacity to dare to have global standards. I think patients are way too much smarter now than they were before, and just a fancy looking clinic is not going to help make that decision. Your skill and time should be valued more than all of the other things.
It cannot.
Yeah, because then it makes you a cheap dentist.
Yeah.
I would be devastated if I got a referral from a patient who sent in another patient because I was a cheap dentist.
That is the single message, very strong message. Hello everyone, and at the outset I thank you all for overwhelming response to the earlier episodes of The Shining Tooth. Today we have brought an extinguished personality with us, Dr. Nikhil Deshpande, who is running his practice not only in Mumbai, but he's treating a lot of patients in the eastern part of the country and providing best of the patient outcomes over there. Dr. Nikhil Deshpande is a dentist who has witnessed and contributed to the evolution of the modern dentistry over the last 2 decades. With 23 years of experience and 18 years of the specialization, Dr. Nikhil Deshpande is a renowned implantologist and cosmetic dentist, leading Swami Dental Clinic with a focus on advanced, ethical, and the patient-centric dentistry. His journey reflects the changing landscape of dentistry, where the clinical expertise, technology, and the patient trust come together to create the future of dental care. Please welcome Dr. Nikhil Deshpande on our show.
Thank you.
Welcome, Dr. Nikhil, and thanks for taking out time to join us for today's discussion.
So my friends joke about this. They said every meeting with you is such that you bring the storm, we bring the brain. So it's like brainstorming, but it's not my brain. It's your brain. I'm just the storm.
The storm is better since sometime you see the things should move, and the storm can move anything.
Yes.
Right? And if things are not moving, then there is no change. So brainstorming is happening with the storm, not only with brain. So this is how I will see. So let's start with the first segment. Most dentists focus on a scaling clinic, right? But do you think many are compromising on the system, processes, or hygiene while growing, rather they are overlooked?
I think it is largely overlooked. I think hygiene, infection control, sterilization, all of these things are like the North Star. Proper management of any clinic involves first, as a priority, the hygiene and the sterilization and the infection control. All of the other things you can keep adding or scaling. Maybe just that one center or one clinic into a bigger center, or scaling into multiple centers which provide maybe just basic care, and then you have one center as like the mothership. That's the formula that's being applied everywhere, where you have this one big center, and then you have a little bit of satellite centers which provide the basics, and then if you need more treatment, you then send the patient off to the mothership or the mother center. I think that's the trend that's going to come up very soon.
The hub and spoke model, which we
Exactly.
can call,
So, but then what should remain constant across all centers is the basic hygiene, infection control, sterilization, so that you can build up trust with the patient. That's the trust that will stay with the brand, so to say.
Can the patient feel the hygiene practices in the dentistry, or it is just a hidden gem?
I think it's invisible.
It's invisible.
And it should be invisible. I wonder if, as a patient, I would want to go into a practice and want to know about the hygiene and infection control procedures. I would like to assume, in the best interest of the patient also and also of the staff, that all of the hygiene procedures are in place, they are standardized, and they are like you have quality control across many manufacturing or service sectors, that this quality control procedure is maintained. I mean, we see this across hospitality industry, in hotels, where you just go into any room to spend the night and you assume that everything is clean and everything is proper. So in the same way, because it is invisible or it may not be prioritized because patients assume it, but then of course it's a matter of integrity for the dentist and his team to do the right thing even when no one is watching. We should be very, very meticulous about that.
You have helped many DSOs grow in the country. I will not drop the name here. And you yourself is doing practice in two extreme part of India, East and West.
Yes.
Right. And both the places you are treating the top of the cream patients, and here you give the consistency of the services. Certainly you would have developed some SOPs,
Yes.
structure which deliver this outcome.
Yes.
Right.
So there has to be a standard operating procedure, like you said, for every practice. And I think if you were to grade practices from, I would just like to say that there are three basic gradations. One is where you provide some basic treatment, where you receive the patient, you diagnose the patient for some basic pathologies, maybe just cavities, cleaning, and some restorative work. And then, of course, there's the second level where the treatments get a little more complicated, where you need a specialist to deliver some treatments. And then, of course, like I said, there is some hospital level practice where you have some major surgeries, some major reconstructions, where the patient needs to spend far more time, number of visits increase, and so on and so forth. So I think for all of these across the board, anywhere where you see or treat a patient, I think we need what is very, very common in the West, which is the standard of care.
Right.
So in India, unfortunately, we do not have any agency, especially in dentistry, that has been able to set up the standard of care. I think we need that standard of care. I think we need some government agency to enforce that standard of care. I think once that has been enforced, we would see major rise in the quality of the care. There is no doubt to the fact that there is a huge demand for dental services. Lack of awareness has led to less patients coming into the clinics, right? So if young dentists, like you said, have this one major complaint, the footfalls are less and the awareness is less, people don't walk in or prioritize dental care. Once the awareness comes in, the first step should be from both the professional side and from the authorities that govern our profession to have the standard of care. We have now set up for ourselves a standard of care. From receiving the patient to operations which have nothing to do with treatments, to treatments or giving post-treatment care even, we have a standard operating procedure. And the basic or the soul of that SOP is that the patient should feel that he is cared for. Because we are in the business of delivering care. It's not just going there and doing treatment. We have to do it with compassion so that the patient feels like the doctor really cares. So if you do care, it needs to show. And I think having a standard operating procedure is the way to go about that.
Is it primarily awareness or the cost of hygiene which is becoming hindrance in including hygiene into the standard of care?
Awareness, hands down. I don't think the cost is a factor at all. Good quality products come at a price.
Right.
But if you really are invested in global standards, look, we have the human resource across the world. Some of the unicorns, like we call them, or the decacons, the billion-dollar companies, they are run by Indians.
Right.
So we have the brain for it. We always had the skill for it. Across the Western world, some of the most skilled surgeons, doctors are Indians. I think we lack an audacity to dare to have global standards. I think we should wake up one day and feel that, okay, my clinic should be a globally standardized clinic. If somebody from the Western developed world was to enter my practice, they should not feel alien. They should feel like they've just entered a globally standardized practice. I said, once we have that aspiration to be globally standardized, I think this cost concern would disappear immediately. So the solution, the key to both your problems, the awareness as well as the cost, is an aspiration or an audacity to dare and say that yes, we will be globally standardized. That's the solution.
So what is the fear factor to bringing that audacity in the mindset of the Indian dentist?
I just think that the awareness to prioritize this
Right.
is lacking more than anything else. And unfortunately, Dinesh, a little bit of that responsibility is on the industry as well.
Yes.
I think the industry that makes and manufactures these products, they need to invest in this awareness.
Okay.
They must come out and try and educate discussion between the industry and the clinicians, where the industry invests in educating clinicians about the advantages of having these kind of products in the practice.
You have always emphasized on the awareness and education piece,
Yes.
while elevating the standard of service in the dentistry.
That's the only way.
Right. However, for the provider side, in the contemporary market, which is becoming more frugal and dynamic, right, where more people are taking the approach to just go in the market with the cost leadership approach. People are reducing focus on creating categories, emphasizing on the education, which is pure play education, which can not only sell the product, but it creates an ecosystem where many products can be sold and many products can evolve, which is the need of the country. Why this piece is missing?
So it's happening on both sides. It's happening with the industry as well as the professional, right? So if professionals start cutting treatment costs, so the first cut comes on the invisible part, what's not visible.
Right.
Right. So person walks into a practice, if it looks fabulous, because jo dikhta hai wo bikta hai,
Right.
right? But jo nahi dikhta hai, what is not visible, is the first one to be cut out from
Right.
those costs.
Right.
The problem on the industry side is that instead of keeping the costs where they are and maybe investing a part of those profits back into educating and creating awareness for those products, the industry is simply cutting out that cost and reducing the cost of the product, thinking reducing the cost of the product will make it sell. And both things are unfortunately not working.
Not working.
The industry and professionals need to come together and say, okay, let's keep the cost as it is. Let's invest a part of our profits from the sale of our products back into educating young people who don't receive this education as a part of their regular curriculum. And let's create this awareness amongst professionals. The industry is free to create awareness among people. I think it's a bit dangerous. It's a double-edged sword. Maybe the costs are also too high because these aren't really FMCG products like toothpaste. We know of some companies that would then go directly to the people. And that would be, I say it's dangerous because people will walk into practice and ask dentists whether, do you use these products? And I think if that happened, all the professionals will immediately switch. So this is like a kill switch. If the industry went directly to patients and said, look, ask your dentist if they use these products because these products are good, right? So I think we are not there yet. I think the industry and the professionals can work together. And I think that is a better way forward rather than the industry going straight to patients.
Yeah, in healthcare, I believe the industry should never go to the patient directly, since patients are already little over-educated or over-confused with the Google and all things in place.
Yeah.
And rather they are troubling the dentist or the other clinician in the therapy areas.
Yes.
Instead of enabling them. Your suggestion is very valid that industry can just take a reflection on the things the way they are doing. This will not only enable the community, but it will increase the pie where everybody will be having, even with the bigger revenue, even if they continue with the same share of the pie.
Cutting costs will never help in the health sector.
Right.
I think we should understand that increasing the quality of healthcare at all costs should be the goal of both the profession and the industry.
Right.
Because eventually people will see the value of it and they will not mind spending that money once they see the value. The onus lies upon the professional to educate his patients and create an awareness among patients. I see so much social media happening about, we acquired this today, we acquired that today, lifestyle posts from dentists about how well they live, and all that is good. But then why aren't we creating awareness about these basic things?
Yeah, right.
I think we should. That's an actionable suggestion from my side.
Yeah.
Right? I think once one company takes this seriously, everybody will fall into place, and everybody will start doing it. We will not need to cut costs. We will not need to, do this undercutting business at all. Only if we invest a little bit time and money in awareness and education.
The things are changing, Dr. Nikhil, across the globe. The healthcare product promotion activity from a wheeler dealer activity
Yes.
to consultative selling approach.
Correct.
And I believe that is what is needed today in dentistry per se,
Absolutely.
when we are growing at more than 10%
Yes.
without having insurance, without having the public coverage.
Absolutely.
It is all out of the pocket, and that way I can say that the
Yes.
therapy area in dentistry is growing faster than any other therapy
Yes.
area.
And the government is sensitized to this.
Right.
They see this private-public partnership approach to healthcare as a viable approach, where earlier government institutions used to be like all government, right? And there was nothing that the private sector could do for that. But now that is also changing. So state-wise, we see people investing in government schemes or policies to set up really, really high value, high standard healthcare setups. So I think we are moving forward. There is progress.
Do you think this National Dental Council,
Yes,
NDC, right,
correct.
which has come into the existence now,
Yes.
will it make some difference?
I think the NDC has many, many expectations.
Okay.
Given that largely we have dental practice not being regulated by the earlier body that was there, the Dental Council, right? There was this education boom, which I feel was responsible for a little bit of neglect towards the direct practice from the authorities, right? In the US, you have the ADA, which is the American Dental Association, right? They set a standard of care for every treatment. Also in the US, you have insurance. So that's another regulatory body,
Yes.
sort of.
Yeah.
Because if you have insurance, you will need standard of care.
You're right.
Without which it's very difficult to manage this three-part game, where you have the patient, the service provider, and the insurer. Again, I think if the NDC could do one grand thing, and like the ADA, bring in standard of care, from the insurance company sides, they will have an assurance to be able to then bring out products that could bring insurance successfully to dentistry in India. And my one major expectation from the NDC is this, for the practice side. Of course, there's this whole dental education side that they have to manage, which is outside of our discussion. But from the practice side, the one most important thing we expect from the NDC is to have standard of care. Right? So for health setups, we have NUB accreditation, we have some standardizations with ISO, and so on and so forth. I think the NDC, if it could come out with standard of care for treatments, then of course, I think we will have a lot of progress from the treatment perspective, from insurance perspective, and I think that will be a boon to raising the standards, and along with it, of course, the prices, and of course margins for both the industry and the professionals.
Yeah. Some of the companies have done really great job, particularly in the implant area.
Yes.
And now they are very serious. They are investing in India too.
That's right.
Right. So we can take the signals, and I believe we both can agree that that is the right direction.
Yes.
When somebody invests in India for the future, then this is the serious commitment.
We have the demographic dividend.
Yes.
We always had it. Right? So for the implant business, I always say this, what's the potential? The potential is we have 1.4 billion people in this country. And on an average, if you take the last 2 decades, every Indian is missing 4 teeth. That's nearly 6 billion missing teeth or teeth that need to be replaced. I mean, it's a humongous market from an implant perspective as far as replacement is concerned. Now, if we were to only service missing teeth, which is not the only job in dentistry, right? There is preventive dentistry, there is restorative dentistry, and now there is replacement and reconstruction. But if you were to only look at the replacement reconstruction part, the setups that would be required would then require from the hygiene maintenance industry a humongous investment in India.
Right.
Because you cannot have clinics where surgeries are performed and reconstruction is performed which don't have the basic standards of hygiene and infection control. This is a good signal for the hygiene industry that if the implants could do well and if the aligners could do well, the hygiene products should be doing well already.
Right.
If they are not, if they're not doing well, there's something wrong.
Yes. Yeah. So now the message to the young dentists that dentistry is evolving. Focus on developing the capabilities. Get a lot of optimism. Companies are investing in India. The demographic dividend sits with us. Just double down on this. The future is bright.
Yes.
Yeah. Now coming to the first 5 years, which are the very critical for any of the dentists, right? They are the formative years, and these years decide where they will build their career or take their career going forward.
Correct.
Right. Now, what is the biggest shock after BDS that nobody prepares dentists for?
I think the biggest shock is the income because you are a professional, considering medical, dental, and engineering as the top professions in India, chartered accountancy, legal. One expects as a fresh graduate to make 7-figure salary or a 7-figure income at the end of the year, right? So if you have your school counterparts or your school batchmates who become engineers with a similar or even a lesser competitive field. I don't want to classify education as lesser, but obviously the competition for engineering at the IIT level or at the general engineering level or the CET level at state can't match up to the amount of competition that is there for the undergraduate NEET level. Right. So there are obviously more people appearing for NEET against how many seats are available versus how many engineering opportunities are available. Of course, if you're an IIT and you're like the creme de la creme and so on and so forth. But let's look at average engineering graduates coming out and average dental graduates coming out and what kind of salaries they make. So that's the first major shock. Okay, I'm a doctor, I'm a specialist doctor, I'm a dentist. And if I have to seek a job now, my salary is, I'm sorry to say this, but the averages are lesser than the salaries of Uber drivers.
Yes.
What drives a professional to work every Monday morning?
Yeah.
You wake up on Monday morning, why do you want to go to work?
Yeah, money brings the quality of life, and everybody wants to start a good quality of life.
Especially if you're a medical professional.
Yes, of course. Of course. This is one of the reasons that in the very first 5 years, many students are lost in the process.
They do get disillusioned, yes. We are seeing this all the time. Coming straight out of dental college, it's not very easy in a very capital intensive business like dentistry where entrepreneurship is the soul of the business as a commercial entity. For a dentist of 23, 24 years to go out in the world and start his own clinic with the little experience that they have just out of college, to be able to deliver the care that will pay them handsomely. So there is a period, I believe, at least a year or a year and a half, which they need to invest in learning the trick of the trade of the business of dentistry, the commercial part of the dentistry. Because college will teach you the basics. Those are the fun years, right? From 18 to 23. So are you going to only study? No. Like you'll watch movies, you'll make friends, you'll fall in love, you've got to get married, so on. So many things there are that you need to do. So in that, you're just learning basics. So the colleges are doing a good job of that. They're teaching you while you're so distracted in life and bringing you out as a professional eventually. And now you need to invest in the business of dentistry. So I feel every dentist who's been in practice for 10 years needs to adopt and employ a fresh graduate. I implore our Honorable Prime Minister, he's very motivating. If he gets on radio and says, Mitro, from tomorrow, all dentists who are 10 years into practice employ one person
And give 50,000 salary.
and salary. It would make no dent
Right.
in their income. In fact, they would probably realize that having an associate dentist who is paid like that, who's paid well, is also has some sense of ownership, and that will probably help the practice as well. But it will train an entire generation of dentists in entrepreneurship, in the business of dentistry as a commercial entity. And we won't see this disillusionment where they don't know what to do. If they can see patients in the practice, they can see what the practice is. If they see how the money comes into the practice, they will then have a better view of their own future.
What I derive out of your inputs that colleges train the students on a skill set, skill sets around the treatment.
Yes.
But how to commercialize and take this skill set to the patient?
Correct. How do you make money off it?
Yeah, they are not trained on that piece.
Not at
and
all.
This ownership comes to the fraternity.
Yes.
Where they can own some of the students, they utilize their skill and then upskill them too. At the same time, they fund them well, so that they and train them on the commercial side, so that they can take the dentistry and their career to the next level.
I mean, whose responsibility is it? To make sure that the entire population views your profession as a worthy enough profession, as a profession worthy of respect, right? It's our job. As a dentist, it's my job that as a regular citizen or as a non-medical person, you view me as a dentist who is a specialist doctor. We need to create this respect, right?
But don't you see that young dentists are too much impatient? They want to win early, want to get early success, and they are lost over some period of time.
You say it's a bad thing. I don't think it's a bad thing at all. And I don't think it's entirely impatient. It's a restlessness, right? We should be happy that young dentists are restless about success, which means they want to be successful. They're not giving up. They're just restless. Now, you have someone who has restlessness. They want success. And the missing part in between is just ambition and a proper direction. So I ask myself this question, it's like, who is responsible for this? Who's supposed to give them ambition? Who's supposed to give them the training for that direction towards success? It's the senior professionals. Who else can do this? Nobody else can do it, right? If we stop educating dentists about newer technologies, if we don't share our experience and knowledge with the younger dentists, whose responsibility is it to do this? Then if you say, okay, they are disillusioned and they're going about complaining about their lifestyle, I think it's our job, and that's why we need to invest some time from our busy practices into training and educating younger dentists. If you can't come out and get on stage and lecture, no problem. Not everyone needs to do that. But you could adopt one new young dentist into the practice and let them have a look as to how you practice. What's the best thing you can leave behind? It's not money, it's legacy. Right? So if you could, in your entire lifetime as a professional, train 20 people, they will carry your legacy ahead. That's the best investment that you can make.
I see few dentists are doing this.
Yes.
I can see you do it. We can see many dentists around your circle and many of the big names in country. They are creating many of them in their clinics. But a larger population is just keeping all the secret with them, right? And they are little scared that if they learn, then they will be sitting next to them.
Oh yeah, I think this insecurity is the killer.
And this is not only in dentistry. This is all a skill-based therapy area, even on the medical side, if you see.
What use is that skill once you're dead? That's what my dad used to tell me. It's like, if you learn everything, you know everything, and you do everything, and now you're busy, right? I mean, all of these senior dentists who've been in practice for 10 years, they're surely busy.
Right.
They're so busy that they don't have time to live the life they can with the money they've made. I'm being honest with you. I know so many people. They brag about or they flex. Now the new term is flexing. They flex about how busy they are.
Right.
They're busy like you can't get an appointment with them for 2 weeks. But then how are you living your life?
Yeah.
Right. So if you could then pass on some of this good fortune that you have created. I'm not saying it came to you out of nothing. You're not just lucky. Of course, you earned it. But can you have a little big heart and share this good fortune with new people and pass on some of your knowledge, experience, and skill? I think that's the best investment you can make.
So you have touched upon very beautiful point, Doctor. Here, we are sitting at an inflection point. I have spent close to around 27 years in the healthcare industry.
Right.
23 years on the medical side and 3.5 years on the dental side.
Correct.
I can say that I'm just seeing the trends which were there around 15 years ago in the medical side.
Yes.
When medical side boomed up, right?
Exactly.
That was the inflection point. The regulation came in, then the structure came in, then the investment came in, the capacity building came in. Disease prevalence has never been an issue. We are having the demography. People need the treatment.
Yes.
Colleges are there to train. Fortunately, on the dental side, only they need some motivation, some engagement, and some commitment from the entire ecosystem. Then we are just sitting at an inflection point.
Yes.
Dentistry is growing at the rate of around 10.5%. And who is funding? Just out of pocket.
Yes.
Right? If these two fund side add to dentistry, I believe the dentistry has a capacity to grow for next 10 years at the rate of 30%, not less than that.
Well, a conservative estimate is about 20 to 23% for sure.
Yes.
Yeah.
Since the disease prevalence is much higher,
I'm taking away 7-8% from your estimates because of the lack of awareness.
Yes.
Although the disease prevalence is there, there isn't enough awareness and prioritization from the patient side.
So once the money comes into the system, people will put the money where mouth is.
Absolutely.
Right.
Absolutely. And exactly where the mouth is.
Right. Now, there are a lot of technologies evolving today.
Yes.
Right. Once the dentists are evolving in the practice, certainly many are shining. I can see across the country. Compromising on technology, on the price point, is a common trend today. And it is created by the provider side, distributors, companies, right?
Yes.
And as I said, the cost leadership approach, right? So there are 4 good brands. I will bring 5 replicas. I will say half of the price.
Yes.
Many places it is working. Many places many people are struggling, right?
Right.
How do you see using cheap technology over the technology which is not only time tested, but where the training, after sales support, enablement is present?
Yes. So I'm optimistic about both of these things.
Okay.
Let's talk about technology products which are cheaper replicas of the standard technologies. So this is happening everywhere. I think the optimistic side for that segment or the value segment of technology that I have is that at least the dentist is adopting this technology. The good part about the standard technology, which is, you could say, higher priced, is that this same dentist who's invested in technology, although at the value side to start with, will eventually in time to come realize the value of the standard technology as to how that is better. I mean, why would anyone sell anything cheaper if it was as good? It doesn't make sense.
Right.
So once the dentist adopts the technology and then sees that, okay, I'm using this technology, but I have a better option, I think they will eventually upgrade. Because in dentistry, the one thing that will keep you afloat, not just survive but thrive, like I say, is upgrade. Every year, you've got to make a plan and set aside some capital to upgrade. Whatever it is, it could be a new place, it could be a new technology, it could be equipment, it could be your own skill training, whatever it is. But you've got to upgrade. There's no way about that. You have to upgrade. The good part about the standard technologies are the industry that is making this very high quality, high standard technology is still interested in India. I'm really happy about this. As long as the best people in the world in technology trust India as a market, we should be happy. Yes, because eventually we will see professionals adopt the best technology.
Yes.
And the push, Dinesh, is going to come from the patient.
Yes.
Yeah, I have no doubt about this. It's my personal experience. When we did not have the best technology, And when we employed value technology in our practice, we could see that, oh yes, we need to upgrade. We could even see that the patient was of this opinion that, is there something better, right? And this is coming from the general technological storm. You have an iPhone 16 today, you want a 17 tomorrow.
Yes.
Right? So if your patient is your regular patient and it's a 20-year-old practice and he's been coming to you for the last 20 years, he's looking to see what's the new upgrade that you have.
Technology adoption is more important, right? Rather refraining masses from the technology adoption, giving them some technology so that once they are friendly and they are ready.
You may not have an iPhone, but you need to have a smartphone.
Yes, of course.
Yeah.
And the moment they have the money, certainly they will have the aspiration to upgrade it.
Every person who has a smartphone aspires to have an iPhone.
Right.
Right. So the technology, no matter what value you bring in at least gives you aspiration to have the best. I think that's what's working in our favor for now.
So here my understanding, doctor, and since you speak about the commercial side also, in India there are 5% of the dentists who are top of the cream. They don't think about anything, they go with the best, right?
Yes.
Then there are close to around 15 to 20% of the dentists who have made their name, they have made money, and they are coming from the larger population of the mass market.
Right.
These people are still confused whether I should continue with the older technology or I should upgrade to the new technology. And wherever they find a right education, right conviction, they switch very easily. So here the responsibility of the organization or the provider side is to continuously educate and propagate the benefit messaging in a right way where they can see that this is going to improve the patient outcome and they will upgrade. The mass market, they should continue be educated by any kind of the technology which is available in the market so that they become familiar and used to the technology to improve the patient outcome. Since the end goal is the patient, right?
It's
and
all
the better treatment,
centric.
right? Since I have not seen any of the clinician in my close to around 2.5 decade of the career who doesn't want to give the best of the treatment to the patient, irrespective of anything.
Absolutely.
Right? So that is the end goal for the company side and that is end goal from the dentist side.
Perfectly said.
Beautiful point. Now, as you said, you have covered a lot of the things which I was about to ask to you. Now, the patient is pushing for the technology. And can you elaborate it with some of the incidences which you have come across in your practice?
So, when someone is seeking something, they are going to use the device in their hand, which is the easiest way to find out what is the best way to deal with it, right? So, when we do some marketing online, whether we use Google or any other part, we always want some keywords in our marketing. It's like the best dentist in Gurgaon. Nobody says, okay, use second best, right? Like, will Dinesh search for the second best dentist in Gurgaon?
Nobody will.
Right? So, they are looking for the best technology. They are looking for the best options. And if you can't provide those best options, they will not come to you. It's just a hypothetical discussion, right? The same area, let's call it Gurgaon. You have two practices. One that is sitting with the best technology. And one that has the technology, but it's not the best. It's the second best, right? And now you have a patient who has the choice to go to one or the other. And let's say he goes to the person with the best technology first. He is obviously going to get exposed to that. Why would you choose second best? Right? And I put myself in this situation. I'm a car lover, right? So if I go to a multi-brand car showroom tomorrow, and I am told that a particular brand is the best because XYZ, but we also have second best. The only reason I would not choose the best is if I can't afford it. Right? And so, looking at dental treatments as an option, because it's a part of the medical field, right? So, if you needed, let's say, God forbid, an angioplasty tomorrow, will you go to the second best?
Never.
Right? So, eventually, this is what's going to happen. We don't realize this from a patient perspective. We are trying to make our practices patient-centric, but we don't put ourselves in the shoes of the patients until we become patients. What determines success is the human element, right? So, earth, fire, water, wind, and then finally soul, right? Which is the dentist himself or the staff, the entire team of humans that are going to deliver that treatment. So this is what's happening. And we need to realize this more than anything else. And once you have that realization, then you will aspire to only have the best, do the best, be the best. And then that will justify looking for the best dentist in Gurgaon. You know, I mean, you can't fake it. 100%.
Right. Perfect. Great perspective. Doctor, we'll speak about the AI and the future of dentistry. Everybody is speaking about AI in every walk of life today.
Yes.
Right. And in healthcare, I can see that there is much noise towards the dentistry about
Yes.
AI in comparison to any therapy area.
Yes.
So how is it changing the dentistry?
Well, I think AI is already here. We already see AI diagnosing whatever data we collect, right? So, especially in scanning and imaging, we are looking at AI making all the decisions. We talked about aligners. Practically everything
Is
in
AI.
aligners is AI,
Right.
It's machine learning,
Yeah.
understanding how these teeth move, what time it's going to take, how to apply pressure. I think the machine is learning much faster, like in every other field, about this, especially in the aligner field. So, in that respect, yes, the AI is moving much faster in dentistry than any other medical field that requires from a treatment perspective.
Right.
From a diagnostic perspective, AI is already there even in the medical field.
Right.
So diagnosing scans, it's now being said that AI is better.
Yes.
It doesn't miss anything. Because whenever you have a human looking at a scan or looking at images or any kind of imaging, there could be a human error in it. But the machines make less errors or no errors is what is being said now. And it's believable because machine learning is the algorithms, keep getting better and better. So we see the same in dental imaging as well. We now have AI programs already on the market, some still on pilot. We have some pilots happening in our practice as well, where if you take an X-ray, maybe it's just a OPG or it's a scan, and then we have a software that will list out all of the pathologies or all of the markers that are there. Not always just pathology, but if there's an implant in the OPG, it will mark it out as an implant. So looking at data and finding out what is wrong with that image or what to point out to, that's already there. We are running a pilot for one of these kind of AI programs where you just send in the OPG and in about a minute, it will tell you everything that's there on that OPG.
Okay.
So I think AI is helping in patient education as a very simple and very effective tool. So we will see more of artificial intelligence coming into the diagnosis scanning part. Another very important part of diagnosis that has now become everyday practice is intraoral scanning, which is a surface scan. So now you have a 3D scan with a CBCT. You have an intraoral scan. We are now seeing slowly but surely face scans, which is again a topographic scan, it's a surface scan. And now we see a merging of these three scans. So you are basically creating a virtual patient. So you have a patient who is real in your chair, and you have a patient who is virtual inside your computer. And now you're trying to explain to the real patient what's wrong in the virtual world. So the patient can see for himself or herself what's going on. We also have AI showing what can be done. So if implants need to be placed, AI will say, okay, these are the places where you're missing teeth. This is how the implant is going to come in. This is how the restoration is going to be. So from a patient data collection, analysis, and explanation perspective, AI is amazing. I think it solves all our problems with patient communication directly.
You've given a beautiful perspective. I never thought that way, but
Yeah.
this is 360-degree perspective. Recruiting the patient, bringing the patient, and then treating the patient, or before treating the patient, educating the patient.
Yes.
Right? And
I think the more important part is patient communication.
Yes.
From recruiting to reaching a point where you have an informed consent.
Right.
And a proper informed consent.
Yes.
It's not a haphazard, taken for granted consent like it was in my father's days. The doctor was God. He said you need to extract, you didn't question anything, you just went through with whatever was planned for you.
Right.
There is very little time between the data collection and the patient understanding what needs to be done. What AI has also done is bringing in what I call wonderment. I talk about this a little. Patients are generally afraid to take dental treatment. They expect pain, right? So we've set a very low bar about somebody coming to us for help, right? They come with fear and they are expecting pain, right? At one point, we thought that, okay, setting the patient with a sense of peace and calm using the ambient environment or the ambience as we now call it, that the patient walks into your practice, it doesn't look like a hospital or a clinic, it looks more like a art gallery or, it's now we see these
Good lounge, right.
theme-based clinics and so on and so forth. So using the ambience to, kind of settle the nerves, that was great. Of course, we are trying to make treatment more comfortable with technology. I don't want to go as far as saying let's make dentistry magical, but let's have some wonderment. Let the patient come to your practice and forget about fear, forget about pain. Let him wonder, right? So if you're doing, let's say, as a part of your data collection, an intraoral scan, where suddenly, within a minute, the patient can see three-dimensionally inside of his mouth on a screen. You do a CBCT scan where he can three-dimensionally see the entire jaw with all the teeth and the joints and everything. And then you have a software where you can merge this data in real time. It takes 5 minutes, Dinesh. In say 15 to 20 minutes, you collect the data and you present the data to the patient. Fear, pain, anxiety, everything is gone. Right? Wonderment is the cure to all of these problems that a patient walks into the practice with.
I'm convinced, while listening to you, this wonderment is a new terminology.
Yes. AI brought wonderment to our practice, which is amazing. And most people don't see it. They think AI is bad. They think AI will drive dentists out of business. That's just plain silly.
Yeah. So this is a message to the fraternity. AI may be kind of a job cutter at rest of the places, but in dentistry, this is a big enabler in their patient recruitment, in their treatment, and delivering the best of the patient outcomes.
Yes. And I don't think AI will ever replace the average dentist.
Yes.
Because in medicine, unlike other fields, you need accountability, right? You need to fix accountability for clinical judgment and decisions on a person.
Right.
Even from a legal perspective, from an ethical perspective, and from the patient's perspective to receive treatment from a human being. In India, even today, doctors are regarded as healers.
Right.
We forget this, right? Of course, we are not gods anymore. I'm sorry. We've been brought down from that pedestal that my earlier generation enjoyed. But we are still on a pedestal of healers, right? Unlike the West, where you have a consumer and a service provider. Right?
That relation will not come in India. It will take a long time.
We are culturally better off than those people as far as that is concerned. So we are still regarded as healers. So the patient wants a human being treating them. The legal system wants a human being for accountability.
Right.
And we need clinical judgment that comes from compassion.
Right.
I think we are forgetting this in the whole technological storm. A human being needs to treat a human being. If a machine is treating a human being, you cannot machine learn compassion. It's an emotion. It's not a data point.
Yeah. We spoke about this and you spoke about the CBCT too.
Yes.
Right. And you use a lot of CBCT in your practice also.
Yes.
Right. If any of the dentists today assumes that not having a technology or CBCT, kind of the imaging solution is his clinic, will it make him dinosaurs in the contemporary time?
Every successful practice in the future will have patient at the center. So we are looking at a patient-centric practice as the first level of success, right? So if your practice is not patient-centric, you can forget about being successful. So the dinosaur, if you're not patient-centric, you're going to be a dinosaur. You're going to be extinct. Yes. So if you are patient-centric, then reasonably and logically, you need to be able to explain to the patient what is wrong with the patient and what you're going to do about it, and take an informed consent from the patient about what treatment is to be employed. It's also essential because there is a cost attached. We don't work in a government institution where you can do whatever you want and everything is free, so you don't get.
Right.
So that also requires us to then explain why we are doing what we are doing. All right. So then the next logical and reasonable part is how best can you do it? I think that's where CBCT is undeniably mandatory. That's our opinion. So if I cannot have a three-dimensional data from the CBCT, the DICOM data, I am unable to bring to the patient whatever it is that I have learned. First and foremost, you will not learn anything. There's only so much you can learn from two-dimensional imaging. So you are at a handicap. You yourself don't have all the data. You have some data. Okay. Would you like to, as a professional, base your clinical judgment, for which you will be held accountable, to be based on some data and not all data? Right? So my answer is no. I need to have all the data. Okay. So if you need to have all the data, then you need to have a CBCT. Logical question is, will you have it under the same roof, or would you want to refer the patient outside? Right? I want my patient to sit in my practice, under my roof, until the patient decides whether or not he's going to take treatment with me or not. I certainly don't want to send out my patient anywhere else until he's made that decision. Once he's made that decision, let it be no. That's good. I'm still good with that.
Yeah, the stickiness is created now.
I'm good with that. I'm good if the patient says, okay, doctor, thank you very much. I've learned a lot today. It was very nice talking to you, but I do not want to take treatment with you. That's fine, right? But until that decision is made, I certainly would not want him to leave my facility and enter another common facility where he could be driven to other competitors.
Got it. Got
Right?
it.
I mean, I'm a little bit selfish about that.
No,
Yes.
everybody has to be.
Now, what happens once I have a CBCT under my roof? That data is available to me in minutes. The wonderment I was talking about, right? So if I meet the patient, I say hello, and I tell him, look, we need some imaging and some scans. Once we have them, we will have all the information that we need to decide what we are going to do about it. And then we will be able to present it to you. Would you like for us to do some scans and some imaging for you? Most of the times the patient's answer is obviously yes. They obviously agree to the data collection. Once they see how the data is collected, how the data is analyzed, how the data is presented, and on the basis of how we did the data collection, analysis and presentation, how a treatment plan is presented, that is truly when the patient is in a position to make the informed consent or the informed decision of whether or not to take the treatment. Until then, it's all conjecture, Dinesh. Let's be honest with ourselves.
This is how it is.
It's just you telling the patient what's wrong, the patient believing you what's wrong, and then making a decision based on some data or some information that you've collected along the way. But it's definitely not all possible data.
Yeah, getting the best of the images from CBCT and giving the best of the input, where we can remove the gray area and give it black and white.
And now people will argue about radiation,
right?
Exposing a patient to unnecessary radiation with the CBCT. Of course, it's not like I will expose all of my patients to CBCT, or I will not expose the whole mouth of a particular patient for a particular complaint. But in our practice, like in many, many successful practices I have seen in the West, we approach the patient as a whole. We are not looking only at what the patient has come with as a chief complaint. Of course, we will look at that as well.
Yes.
But I try to tell the patient that, look, now that you're here, let's look at everything. Whether or not to take all the treatment is still in your hands. I mean, I'm not going to tie you to the chair and treat everything today. But let me tell you everything. And patients, I can tell you, appreciate that. So before I buy my Mercedes GLE, maybe I should buy the CBCT. We cannot, as educated professionals who aspire to deliver globally standardized care to our patients, have warped priorities. Our priority should be our patient. Like I tell everybody, like before you buy your BMW, buy the CBCT or the intraoral scanner or the laser, or invest in your own level of care first.
Right.
Yes, and then you can enjoy the spoils later.
Yes. And patients will enable you.
Yes. So to
good
answer
care
your
will
question,
enable you.
we need a CBCT.
This is a good message to all the aspiring dentists, and I believe you have summarized it very well. What is required to grow the practice, what is required to become future-proof for next 10, 20 years in the career.
Upgrade.
Yeah, upgrade. That is the single message, very strong message. Let's do some fast fire or the strong ending questions here.
All right.
Right. I will start with the first. One thing young dentists should stop doing immediately.
Oh, complaining. They should just stop complaining. Right? Get up, dress up, show up.
One investment every dental clinic should make.
I think the intraoral scanner is the first most mandatory investment.
One thing patients should know before choosing a clinic.
If I was a patient, I would look at so many things. Right? I would be that patient who would walk into a practice and say, can you show me?
Since you know the dentistry inside out.
So since I'm a medical person, I would like to get into the things I cannot see. Right? So patients should definitely look at 2-3 things. One is whether technology is an active component of the practice from the start right up to the end. Second is clearly what is the approach of the human element in the clinic. Yes. Whether they are approaching you as a center of everything or whether you're just a piece from whom they want money. Right? And that's very obvious sometimes.
That is very apparent.
Yeah, it's very obvious. And the last thing is whether you would like to associate with this practice for life. Because dentistry is for life. It's not an event in your life. It's somewhere you will go every year. So would you like to keep coming back to this place? Right? So these are the 3 things that I would look at as a patient.
We asked, you give 3. We asked for 1 and you gave us 3. So what does successful dentistry mean to you today?
That's a very, very, it can be a short answer and a long answer.
Right.
So the short answer is every patient treated successfully.
Perfect.
Is success.
Yep.
Yeah. If I'm truly patient-centric, I'm only concerned about being successful or having a successful treatment outcome for that one patient that I'm treating now or the practice is treating now.
Yeah.
And then, of course, all of this will accumulate and translate into more success eventually, yes. But I'd like to treat that one patient successfully.
Patient is your ambassador out of
Yeah.
Yeah. There are some other questions which I will ask to you. They are very pertinent and they will be on the other level. First one is, are some clinics looking modern from outside but outdated from inside?
My answer is yes. We do see that in the same sense that we were talking, jo dikhta hai wo bikta hai. So unfortunately, some practices get misled in that direction where they feel that having great looking clinics would lead patients to making the decisions that they need to make or they will choose those clinics based on the interiors. But I think they're just being foolish. I think patients are way too much smarter now than they were before. And just a fancy looking clinic is not going to help make that decision.
Thank you. Another one, can cheap dentistry or become quality dentistry?
That's impossible. That's impossible. I think good quality is never cheap anywhere. I think so. No, the answer is a straight no. And I have a point to make here that most people don't think about. What should be the most expensive or the most valued component of the treatment cost? right? We seldom think about it. Should it be technology or should it be the human element? I feel your skill and time should be valued more
Yes.
than all of the other things, because all of the other things could be in another center where you are not there.
Not there.
Their cost will still be the same on the technology or on the equipments or on the products, but your cost is what makes the treatment more valuable, and therefore time and energy and skill should be more than the rest of them.
Yeah, every dentist should optimize the 8 or 10 hours he
And then if
works.
you put in the calculations, Dinesh, it cannot be cheap.
It cannot be.
Yeah, because then it makes you a cheap dentist.
Yeah.
Do you want to be a cheap anything? No.
I believe nobody who is watching this want to be a cheap dentist. Everybody want to have a good quality of life,
Yes.
sane mind, so that they can come and
Yes.
treat the patient peacefully.
I would be devastated if I got a referral from a patient who sent in another patient because I was a cheap dentist. Nobody wants to be a cheap dentist.
Coming to the next question. Do you believe or feel that few dentists don't accept the technology since they fear the technology will expose the inefficiencies?
From a data perspective, that is true. So if I wanted to evaluate your work, if you were a dentist and I had a patient who's walked in from your practice to my practice, and if I wanted to, hypothetically, let's say, wanted to evaluate the work that he received in your practice, technology will give me all the data points today. Right? It's going to tell me everything. You can't hide it.
Yeah, this is black and white.
It's going to be black and white, like you say. So in a sense, it's not something you should fear. It's something that you should use.
Now, very different kind of a question here. Are dentists spending more on Instagram than infection control of their clinics or
Are they
instruments?
spending more on marketing than on focusing on the patient-centric part? Dentists are spending more money trying to get the half circle done. So the full circle of dentistry has two parts, right? The first part is to recruit the patient, like you said. And that part ends when the patient is in your chair. So the first decision the patient makes is to come to you to seek help. That's the first part.
Right.
The second part is when you deliver whatever is required for this patient and the patient pays and moves out, enters your follow-up care and refers more patients to you. That's the other part. The first part has part marketing, which is what you talk about when you say Instagram and social media, and there are so many ways that this is happening. So people are really trying to spend more money trying to get the patient in the clinic and on the chair. Whether it works, it doesn't work, it's a matter of discussion. But yes, we are now spending far more on marketing our practices as a unit than we were before.
Okay.
For sure. We are advertising, we are marketing, we are doing social media, we are doing whatever it is that is possible to get the patient on the chair. And then, because you're spending so much on the marketing, you're trying to compensate at the clinical treatment part, which is a bad decision for business. You should have those procedures set up first, because once the patient actually comes to you as a product of that marketing, the marketing guy's job is done, boss. He is not going to help you make your patient decide whether to take treatment or not. He'll only bring the patient to the clinic, right? It's after that that the patient decides. So I am not saying don't focus on the marketing. Or please do.
That is required.
Please get, if you are the best at what you do, you should go all out to bring the patients to your practice. Why not? Yeah, I'm all for that. Please do that. But then first become best.
Beautifully put. Now, is affordable dentistry sometimes just compromised dentistry in disguise?
It is a disguise. Affordable dentistry is a misnomer. It's just cost cutting with cheap practices.
Fair. Last but not the least, Will dentists who don't adopt to technology disappear in the next decade?
I think the practices will find it very, very difficult to survive. Very, very difficult. I think technology is here to stay. The faster you embrace it, the faster you use it to its full potential, the better it is for you as a dentist today.
Thank you, Dr. Nikhil. Thanks for
Thank
spending
you
your
very
time. We
much.
had a very good discussion today, and
I hope so.
I'm sure we have created a lot of nugget out of your wisdom, which will certainly help our audiences to shape up their practice and the
Yes.
career. The patients who are watching us, they will be able to make the good decision while choosing the practices and improving their dental health. Thanks everyone who are watching this episode till end for investing your time. I'm sure the discussion with Dr. Nikhil Deshpande has created some wisdom nuggets which will help aspiring dentists to shape up their career and make a bright future. For the patients who are watching here, they will use these insights to select the right practice and improve their smiles. Your feedback is very important to us. Please provide it gets help us get better every day. Please like, subscribe, and follow us. Thanks a lot.